Just going to share this. So let's have a look at potential scenarios you can find and different ways to handle them. I'll make this a slideshow really quickly. So imagine here you've got a 65-year-old male. He presented the emergency department with chest pain. Common situation, there's chest pain behind the breastbone. It radiates to the chest. It's dull pain. It's usually worse when I exercise. I go to the hill. I go up a hill to the shop every day. And so, you know, I get the chest pain, then I sit down and it goes away with rest. It all started around 6 months ago, doctor. And yeah, it gets better when I rest. Right. Then you continue the rest of your history. There may not be anything significant. But remember, guys, in cardiology cases, family history is part of the risk factor assessment. And so maybe your father died of a heart attack. Maybe a father had a bypass done before, or a mother or a relative, let's say father. Don't we ask for aspirin and offer him to take, Dr. Radwan? Absolutely. Aspirin 300 mg must be done. But remember, if the person is not taking any medication and doesn't have any aspirin, then you know you're not going to offer it if you're on the phone. But if you're face-to-face, 100%. For stable angina, we'll do that next. I'll walk you through the approach to stable angina. For stable angina, it's a lot about symptom control and advice. So that's coming next. So 65-year-old male, in the emergency department, comes with chest pain. Again, for this one, smokes 20 cigarettes a day, diet consists of fast food, drinks 1 shot of whiskey every night to sleep, doesn't exercise, okay? And the father died of a heart attack when he was 60. So we need to do the management. For the management in this particular station, what is it going to be? To explain to them that they could be having angina. Somebody just asked me, for stable angina, should we refer? Again, the referral is to confirm the diagnosis, and the diagnosis referral is based on local arrangements. So in the exam, they're not testing where you referred, but you'll tell them to, usually we do need to confirm it by doing a few of these tests known as exercise stress tests. But mainly, okay, because the main type of exertion is going up a hill or just exercising and you're resting, and it doesn't last very long, okay, it's possible that we can give you some medications to help with the symptoms. And I'd also like to talk to you about some of the lifestyle changes that are important. And so the lifestyle changes that are important are very simple. GTN spray, first and foremost, for the medication. You need to explain how they should take the GTN. Okay, so you can spray it under your tongue, okay, when you get the pain. And obviously, this will definitely relieve you of your symptoms. If you are about to do any activities, okay, that could exacerbate chest pain, you can also take the GTN spray before exercise, before going up the hill, and before sexual intercourse as well. Good. We'll also usually prescribe medications to help slow your heart down and help with the symptoms. Okay, these are known as beta blockers, and they should help slow down the heart and dilate the vessels so that it's not so damaging in terms of the blood flow. Good. Secondary prevention is aspirin, blood pressure control, and statins. That is the secondary prevention. If you suspect somebody is having a heart attack, such as in this case, they're going to go to the rapid access chest pain clinic. And this is where they will have a confirmation of diagnosis done. And even in cases like chest pain from stable angina, you can send them for confirmation of diagnosis to the rapid access chest pain clinic. Finally, we need to talk a bit about some of the risk factors that could exacerbate or make the situation worse. Smoking usually contributes to poor blood flow. And it's important that you understand, Mr. Johnson, that when you smoke, it increases your risk of heart attacks in the future. And with stable angina, at the moment, it's reduced blood flow, but it is not an emergency because it's stable. But if you continue to smoke, this could just increase the chances of a heart attack in the future. Would you be willing to consider quitting smoking? Yes. I'd like to refer you to the smoking cessation clinic. Another area that I'd like to talk to you about is your diet. In terms of your diet, you mentioned that you eat fast foods. Fast foods are high in oil, they're high in cholesterol. And so this contributes to blockage of the arteries from fatty substances known as cholesterol. And so usually we advise a healthy, varied lifestyle and balanced diet in terms of the food you eat, to try and eat grilled foods instead of fried foods. What do you think about that? Would you think that that's a change you can make? Other than that, you can also include more vegetables, greens, and fiber in your diet, and drink plenty of fluids and water. Try to get some movement in as well. You mentioned that you're getting old, and I do understand that you can't move around as much as you used to, but sometimes it's just about standing, and moving your arms and different softer exercises that just slowly get your heart going. Because you're having stable angina, light exercise is still safe, and I can refer you to a dietitian and a health coach so that we can continue to give you proper advice. And finally, you mentioned that you drink 1 shot of whiskey every night to sleep. Now, 1 shot of whiskey is about 1 unit of alcohol, and that is below 14 units of alcohol in a week, which is what we recommend as medical professionals. However, it's also important to try and go a few days without drinking alcohol. And so having 2 to 3 alcohol-free days is also quite important. Is that okay? Good. So anyway, your management is medical and it's lifestyle as well. The management is very long because you need to give advice on GTN, and you need to ask about their sexual life if they're sexually active. Because if they're sexually active and if they use Viagra, those are 2 areas that must be explained. For Viagra, never take GTN spray with Viagra within 24 hours of each other. But if the person is not taking Viagra, then you don't need to give this advice. The other advice is what to do if the GTN spray doesn't work. This is safety netting. So if you get chest pain and you use your GTN spray and it doesn't work, wait 5 minutes and take another one. If it still doesn't work, wait 5 minutes and then take your 3rd and final GTN spray dose, and also call 999. We'll be prescribing you aspirin. And so in the future, if the GTN isn't working, take 4 75 milligram aspirin tablets immediately and call 999 so that we can help you. Good. On examinations, you can find different findings. And as you can see here, it could be a high BMI of 32. So the patient has weight that is on a higher side. That might be something you have to add into your explanation. And so it could take a very long time. And Dr. Nida, I would like you to now try to be the patient, and we'll do a stable angina case together if you're still around. So that we can balance some of the advices in 8 minutes. It's a lot of information to give the patient and a very short time of history taking and examinations and things like that. So this is a face-to-face scenario. It's a 65-year-old male, and you can be any name. I'll just ask you to confirm your full name and your age. And then I'm going to also take history about your pain and try and get the risk factors. Is that clear?
Yeah.
All right, let's go.
Begin. Enter the room.
Hello.
Hello, doctor.
Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the emergency department. Can you just confirm your full name and age, please?
Yeah, my name is Tom Hardy, and my date of birth is 1950.
Your date of birth is 1950.
1960.
Thank you very much.
Yeah.
Okay, thank you very much. What would you like me to call you today?
Tom is fine, doctor.
Okay, very nice to meet you, Tom. I'm sorry to hear that you've been having some chest pain. Can you just tell me a bit more about your chest pain?
Yeah, doctor, it's there in my chest. You know, it's very painful.
Okay, and are you having chest pain now by any chance?
Yeah.
Okay, and where exactly in your chest? You mentioned it's right in the center, is that right?
Yeah, I hear in the center.
Yeah, you pointed at your center, I can see.
Yeah.
Right, and did your chest pain start suddenly or gradually?
It started suddenly, doctor, but it's going on for like a long time now.
It's going on for a long time.
Yeah.
Right, okay. And has anyone done any investigation such as an ECG for you yet so far?
No, you're the first doctor I'm seeing.
Okay, and you mentioned that you're having the chest pain now. Can you just scale the pain for me? 0 being no pain and 10 being the worst pain you've ever felt?
6, 7, doctor. Between 6 and 7, I would
6 and
say.
7. Okay.
Yeah.
I just need to quickly ask you, are you allergic to any medications?
No.
Okay. And do you have any medical conditions at all, such as asthma?
No, doctor.
Okay. And have you ever tried any painkillers so far?
No.
Okay, so we'll have some pain relief administered for you. The nurses will come in a second. I'm really sorry. If you could just bear with me, I just want to know more about the chest pain, okay?
Yeah, all right.
Now, can
Okay.
you describe the pain and the character of your pain?
It's, doctor, just a squeezing pain, you know.
Okay, squeezing pain.
Yeah. Yeah. It's like
And does it?
someone just
Mhm.
hug tightly.
I'm so sorry. I really am so sorry. I can see that you're in quite a lot of pain. Please bear with me. I'll try and get to the bottom of everything and help you best. Does
Thank
it go
you.
anywhere?
Yeah, doctor, actually it goes all over my chest.
All over your chest.
Yeah.
Okay. Okay, I see. And you mentioned that you still have the chest pain. Is it the first time you've had this chest pain?
No, doctor, I mentioned it's for a long time now.
For a
6
long
months.
time.
Yeah.
6 months. Okay.
Yeah.
Does your pain come and go?
Yeah, doctor, I noticed, I love to do exercise, especially hiking, and when I go uphill,
Okay.
it's there and it usually
Okay.
comes at that time.
Okay.
But
And
when
when you get the pain, when it comes that time, what do you do?
I just sit down and rest and then it goes away
Okay.
gradually.
Okay. So rest makes it go away. Right. Thank
Yeah.
you so much for answering my questions. Just a few more things. Are you running a temperature by any chance?
No,
Okay. Have you got any shortness of breath?
no,
Any coughing at all?
no, doctor.
Okay. Any pain in your calves?
No, no,
Okay. Any weakness or sensation loss anywhere in your body?
no, doctor.
Okay, thank you very much for answering my questions. You mentioned that you're having the pain right now, so it's important that I arrange an ECG for you to make sure that we can do an electrical tracing of your heart as well, and check your heart. I just want to make sure I also ask a few questions about your general health to help me understand everything better. Do you have any medical conditions? You mentioned you don't. I just want to ask about high blood pressure or high blood sugar in the past.
No, doctor, not at all.
Okay, and are you on any herbal remedies or any medication at all at the moment?
No, doctor.
And like you said, you don't have any allergies. Is that right?
No.
Okay. Sorry to ask you this. We do need to ask anyone who comes with chest pain. Has anyone in your family ever had any heart problems in the past?
Yes, doctor. Actually, my father died of heart attack at the
Your
age
father
of.
died of a heart attack.
Yeah.
Okay. I'm really, really sorry to hear about your father. And I hope everything is okay. When did that happen?
Doctor, when he was 60, he died
When he
of
was
heart
60.
attack. Yeah,
Okay.
so around my age. Yeah.
Okay. Around your age. Okay. And finally, is there any chance you've traveled abroad recently in the last 6 months?
No,
Okay.
no,
May I ask what you do for a living?
nothing, doctor. I stay at home.
You stay at home. Okay. And
Yeah.
who else is at home, if I may ask?
I'm alone, doctor.
You're alone. Okay. And do you by any chance smoke cigarettes?
Yes, doctor, I do
Uh,
smoke.
how many cigarettes do you smoke
20 a day.
a
Yeah.
day? Okay. How long have you been smoking, if I could ask?
Oh, long time, doctor. I mean, since
Okay.
16, I say, yeah.
I see. Okay. And do you drink alcohol?
Yeah, not too much.
Not
Just a shot every night. Just one.
okay. One
Yeah.
one shot of whiskey a night. Okay. All right.
Yeah.
And can I just know a bit more about your eating habits? Do you eat out or do you cook at home?
No, to be honest, doctor, I don't like cooking, so I usually just grab a takeaway every
Okay,
night.
I see. What kind of takeaway food do you usually grab?
Fish and chips most of the
Fish and
day.
chips.
Yeah, and
Okay.
sometimes curries.
Okay. And you
Yeah.
mentioned that you're having this chest pain for the last 6 months. How has it affected you?
I mean, doctor, I love, hiking, and it have just, hindered me of my passion or my joy, I would say. So,
I see. Okay.
yeah.
And does that cause you any anxiety or feeling down about that?
Yeah, when I go out, I feel happy, and now I'm just staying back home,
Okay.
so this pain doesn't come, and that's
Okay.
why I'm here today. Just
Okay.
if
Okay.
you can help.
So thank you for allowing for answering my questions. I really hear you there, and I can see it's really affected you. I'd like to
2 minutes
quickly
remaining.
examine you, do your general observations, check your blood pressure, your heart rate, check how fast you're breathing, your temperature, make sure you're doing okay, and also do an ECG. Listen to your heart and listen to your lungs. from everything that you've told me, Tom, unfortunately, I suspect that the cause of your symptoms could be what we call stable angina, but we need to make sure also that you haven't had a heart attack. Is that clear so far?
Yeah, doctor. Yeah.
Okay. So we'll do a routine blood test. We'll check your heart markers as well for any signs of that, and we'll be doing the ECG. Now, I also need to refer you to my seniors. We do need to confirm the diagnosis through some means as well. Sometimes we'll do some testing as well. But mainly, what's going on is that there's reduced blood flow to your heart. And usually when your heart needs to pump blood around the body and there's reduced blood flow, it can cause chest pain.
Okay.
Yeah.
It's
So,
not a attack, doctor, right? It's not a heart attack.
again, from what you've told me, it's for 6 months and it doesn't seem to have changed apart from today. So I do want to rule that out since you're with us. But we'll be giving you something for the pain. It's called a nitrate. It's a spray that you can use whenever you get the pain, and it should help and it should make things go away. The way you take it is you spray it under your tongue. And obviously, it's important you know that if the first time doesn't work, after 5 minutes, you can try again. And if it still doesn't work, after 5 minutes, you can try for a third time and wait and call 999 as well after 5 minutes if it hasn't gone away. So you'll be taking it a maximum of 3 times, waiting 5 minutes each time. Is that clear?
Yeah, that's fine,
Okay.
doctor.
And if it ever gets to that point where you have to call 999, I just want you to know you should also take some aspirin. We'll be prescribing you medications today, and I'll go through those with you as well.
Move on to the next station.
So there you are, guys. As you can see, right, when you're doing a scenario, it's important you know what's being tested. And in this particular instance, I think what's being tested is to recognize and start initial management. Nida, do you have any feedback at all?
It was really good, Dr. Radwan. I mean, the history taking part, nothing was missed. Because it's heart station and the chest pain station, and I think asking ICE is like the waste of time, I think. But at the last, like I just noticed that you were a bit fast, maybe when it says like 2 minutes is left. So usually what happens is the patient can ask, what are you going to do for me? Or they can show panicking and all that. But maybe you were just trying to cover the steps.
Yes.
For the exam purpose, again, I would say that it's not really necessary for the students to cover it. Don't panic if it usually it never ends. And there are few stations that you just do like, oh, I have done all the stations, all the steps done. But usually you can't do it because you have to address the concerns of the patient.
That's right.
So, yeah, so I was just expecting a bit more slowly so I can say, what are you going to do? And then maybe you want, I'm alone, but maybe I am alone and there is my daughter or my son living nearby, so they can come here. So you want to call someone,
Yes.
Yeah. So just that, and it was really well, just maybe.
That's amazing. That's good feedback. That's amazing feedback.
Yeah.
Yes,
But it was
definitely.
perfect. 10
All
on
right,
10.
that's great.
Yeah.
So there's always room for improvement, and we'll keep at it.